what do you think of the new crop of residents?
I think they're going to need more supervision than the last group. The challenge with them is determining which ones we can trust.
Well, shouldn't we have the same level of supervision for all of them, so the services they provide, along with ours, are properly billed?
I guess we do have those teaching physician rules in place, but how do you explain the rules so they'll know what they can do? They're also eager to do more.
I bet I could explain it in just a few minutes. Pick any resident.
Are you kidding? Those rules are confusing. Marina, I'll take you up on that. If I win, you take my call on Saturday.
Deal. Let's go.
You, come over here and listen for a few minutes, and you'll learn the key teaching physician rules. Dr. Janikova will be your attending.
The attending physician needs to be present during the key portions of an exam, and both you and the attending should document in the record that you were there. If the attending is not there, you or the attending should note that in the medical record. Make sure your attending writes in complete sentences like, "I examined the patient and agree with the resident's findings." Writing things like "discussed with resident and agreed" or "patient seen and evaluated" is not enough. Is that clear?
You're doing well, but what about surgeries?
The attending needs to be in the operating room for the critical and key portion. Otherwise, they could be immediately available. If there are 2 concurrent surgeries, the attending must be available for the critical and key portion of each. If the attending can't be immediately available, another physician should cover.
I have one to stump you. What about when the resident provides services in the community clinic?
Well, it depends. If the clinic is part of the hospital's teaching program, then the same supervision rules apply, except if the clinic is considered a primary care center, which can include an outpatient department. Residents in these clinics who have completed 6 months of training can provide billable services without the presence of the teaching physician. The same case applies when a resident is moonlighting outside of the teaching program. Does that answer your question?
Yes, it does. Now, what should our resident care about when he supervises med students?
Medical students can do the review of systems and past family or social history without the supervision of either the teaching physician or resident. The teaching physician can refer to review of systems and the family or social history taken by the resident, but must separately verify and redocument the history of present illness, physical exam, and medical decision making.
You did it.